Clitoral hood reduction, also termed clitoral hoodectomy, clitoral unhooding, clitoridotomy or partial hoodectomy, is a plastic surgery procedure for reducing the size and the area of the clitoral hood, prepuce, in order to further expose the clitoral glands of the clitoris. It is sometimes done as a form of elective surgery where the therapeutic goal is to improve the sexual functioning of the patient, and the aesthetic refinement of their vulva. It is a form of hoodplasty. The reduction of the clitoral prepuce tissues usually is a subordinate surgery within a labiaplasty procedure for reducing the labia minora, and occasionally within a vaginoplasty procedure. Surgical procedures. The procedures for labiaplasty occasionally include a clitoral hood reduction. One technique for reducing the clitoral hood is the bilateral excision, cutting, of the prepuce tissues covering the clitoral glands, with especial attention to maintaining the glands in the midline. Another technique cuts away, excises, the redundant folds of clitoral prepuce tissue, with incisions parallel to the long axis of the clitoris. Clitoral hood reduction can be included in the extended wedge resection labiaplasty technique, wherein the extension of the exterior wedge sections is applied to reducing the prepuce tissues of the clitoral glands. Yet, occasionally excess prepuce skin, in the center of the clitoral hood, is removed with separate incisions. Results. The functional corrections and perceived aesthetic improvements to the vulvovaginal complex indicate that labiaplasty procedures have a high rate of patient satisfaction with the surgical outcome, and a low incidence rate of medical complications. The study Aesthetic Labia Minora and Clitoral Hood Reduction using Extended Central Wedge Resection, 2008, reported that of a 407 woman cohort, 98% were satisfied with the labial reduction outcomes, that the average patient satisfaction score was 9.2 points on a 10-point scale, that 95% of the women experienced reduced pudendal discomfort, that 93% of the women experienced improved self-esteem, that 71% experienced improved sexual functioning, that 0.6%. One woman reported lessened sexual functioning, and that 4.4% of the women experienced medical complications. Moreover, regarding the woman's satisfaction with the plastic surgical outcome, the study Expectations and Experience of Labial Reduction, a qualitative study, 2007, reported that the women who underwent labiaplasty had great expectations for the elimination of pubic discomfort and pain, improved cosmetic appearance of the vulva, and improved sexual functioning. Most of the women experienced improved self-esteem, yet the study also reported that formal psychological counseling before the surgical operation, about what to expect and what not to expect from a labia minora and a clitoral prepuce reduction procedure, might better serve the woman, as the patient, by assisting her in establishing realistic, feasible, goals for her genital beauty and mental health, which might be derived from a genitoplastic procedure. Criticism. The American College of Obstetricians and Gynecologists, ACOG, published Committee Opinion No. 378, Vaginal Rejuvenation and Cosmetic Vaginal Procedures, 2007, the college's formal policy statement of opposition to the commercial misrepresentations of labiaplasty, and associated vaginoplastic procedures, as medically accepted and routine surgical practices. The ACOG doubts the medical safety and the therapeutic efficacy of the surgical techniques and procedures for performing vaginoplastic operations such as labiaplasty, vaginal rejuvenation, the designer vagina revirgination and G-spot amplification, and recommends that women seeking such genitoplastic surgeries must be fully informed, with the available surgical safety statistics, of the potential health risks of surgical wound infection, of pudendal nerve damage, resulting in either an insensitive or an oversensitive vulva, of dyspareunia, painful coitus, of tissue adhesions, epidermoid cysts, and of painful scars.
Please subscribe and thanks for watching.